Welcome to the strep testing competency video. Today we will walk through performing a strep test for quality control, as well as obtaining a sample on a patient and then running the test. It's important that when you go into the room to discuss obtaining a strep test sample with a patient, that you explain the test very clearly so that you can elicit the support of the patient and the cooperation of the patient. The patient will need to open their mouth wide, stick out their tongue, and say ah, and this will give you a good visualization of the oral cavity of the mouth. You'll need to take the cotton-tipped applicator and touch both tonsils on each side, and if you can, rotate the cotton-tipped applicator to get sufficient amount of exudase or fluid from the tonsils to ensure a proper test result. And again, as with all CLIA-waived testing or any patient interactions, we want to be sure that we're verifying two forms of patient identification when we enter the room and before we do any invasive testing. And that can be the name and date of birth or the patient's last four of their social as per Wheeler Clinic policy. So when you go in the room, you really only need to bring the swab and a patient label, which the patient should verify is correct information, so that you can label the specimen when you take it out of the room. You will perform the testing in the lab. When you're doing the testing, you want to be sure that you're wearing gloves. You've performed hand hygiene before using the gloves. And then you also should be wearing a mask because you will be within 3 feet of the patient in their personal space and susceptible to droplets from the patient. So today we will perform the testing, and I have a guest who will kindly subject themselves to a strep test with me. I'm going to do hand hygiene, and then I'm going to apply gloves. So, I'm not sure if they can't see you. No. Come closer, victim. So today we're going to perform a strep test. I'm understanding that you are having some sore throat, some pain in your throat. So we want to collect a sample to check for strep. Okay. What I'm going to need you to do is to open your mouth wide, stick out your tongue, and just say the word ah, and that will help me see your tonsils. Okay, it's important that you stay still and not move during the procedure. You may feel a little tickle in the back of your throat when I do this, and I'll be very quick. And as long as you stay very still during this procedure, I won't have to repeat it. Thank you for willing to be a victim here. Okay, please open your mouth and stick out your tongue. I'm going to insert the stick and touch both tonsils.
Okay.
Thank you. Okay, so I've gotten the patient's sample. I've placed a label on the sample package, and I'm now going to prepare the test tubes to be able to test the patient's sample. So we have 2 extraction reagents. We have 1 bottle that says number 1 and 1 bottle that says number 2. We will verify expiration date, which is both May 2017. So you'll swirl both bottles to be sure the mixture is completely mixed, and we're going to place 4 drops into the tube of number 1, and then we will place 4 drops of number 2. Give that a gentle swirl to ensure it's mixed. We'll then take our sample swab and insert it into the test tube. And I'll try to show you. We're going to swirl that 10 times to ensure that we get enough of the specimen sample mixed in with the fluid. And then we will put that down and let that sit for a minute. Meanwhile, I can show you how to do a control test. So again, we're going to take 4 drops of reagent number 1, put it into our tube, 4 drops of reagent number 2, and then we can swirl that around. I have 2 control bottles One is a negative control and one is a positive control. The expiration dates on these two bottles are well in advance of June 2017. So we'll do the positive test. So I'm going to place 2 drops of the positive sample, control sample, in this fluid. And again, mix that around. And then we'll take a swab, a clean swab that's not been used on a patient, and insert it. And again, swirl this around 10 times. And then we'll let that sit for a minute. This has been a minute, so we're going to go ahead and take the sample swab out. And as we take it out, we're going to squeeze. This is a flexible tube. We're going to squeeze the cotton-tipped applicator to just kind of get as much fluid as we can out of there. This can now be discarded into the regular waste, and it's ready to accept the testing strip. Here is the testing strip bottle, and again, verifying expiration date of May 2017. And hopefully you can see on here, it does have a legend to tell you how to read the sample stick when we put it in there. This has a control line and a test line. So the presence of a control line will indicate that the test is valid. If the test does not have a control line, the test is not valid. So there are arrows on the test strip, and that's the way it indicates to you how you put it into the tube. So you take it out and you put it straight into the tube. And then you set your timer for 5 minutes. And this works similar to some other CLIA-Wave tests, in that in the test area, if there is no line, then the result is negative. If there is a line in the test area, then the test is positive for whatever you're testing for. In this case, it would be strep. If the test does not show a line next to the C or in the control area, the test is not valid, regardless of what the line or the presence of a line may indicate in the test area. So just that clear distinction, there must be a control line in order for the test to be valid, regardless of whether there's a result in the test area. So in our control sample, we're going to take out our swab, squeeze the excess fluid out of the swab, and discard. And then we'll insert another strip into that test tube. Again, taking it out of the tube, and the arrow is pointing down, goes straight into the test tube. These results will all be recorded in the quality control log for the quality control test, and then the patient testing log for the patient test results. And then it will then be recorded in the patient's electronic health record. And then the results of the test should be shared with the provider so they can base their care. In some scenarios, if the test is negative and the provider feels strongly that the patient is suspicious for having strep, they may send the culture swab to the lab for further analysis. So it's been 5 minutes, so let's look at our results. So this test shows the presence of one line in the control area and no line in the test area. So this result is negative. This person does not have strep. Okay, so again, there's a control line there, indicates the test is valid, but no other line. So on the log, in the patient's testing log, you would also record the presence of the control line to indicate that there was a quality control, internal quality control performed with this test, and that it was a valid test. It's not been quite 5 minutes, but this positive control has already resulted to show us that it is positive. So we'll take this out, and as you can see, the top line is the control line, and that means the test is valid. And then there's a second line to indicate that their test is positive, which goes in line with my using a positive quality control. So this test is positive and the quality control was effective and valid for this box. Quality control should be done every time you open up a box or every time there's a new staff member starting to do testing. They should then perform quality control to ensure that they're competent to perform the test. When you are with your observer and performing this test for competency, it's important that you feel comfortable and you have been able to validate that you can obtain a proper sample from the patient. Without a proper testing sample, you may get some false negative results, which is one of the reasons why we send the sample often when it's negative to the lab for further analysis, because it's a more sensitive test in the lab. Strep throat can cause a very serious infection if it is left untreated. So it's why we have a double check on that test result to ensure we haven't missed anything. So at the end of testing, you would remove your specimen tubes and again discard them in the regular waste. There's no biohazard here. You would clean up your area. And remove your gloves. And then perform hand hygiene. And that concludes the quality control testing video and competency video for strep. Thank you.